Welcome, everyone, to our 7th virtual town hall panel. This panel is sponsored by the City of Steamboat Springs and Routt County in partnership with the Steamboat Pilot In Today. And I am editor Lisa Slitchman, and I will be moderating again. Today's panel, we're meeting here with several nonprofit leaders in our community, as well as the Yampa Valley Housing Authority, which is a quasi-judicial organization. And all of these groups are serving our community during the COVID-19 crisis. Our goal today is to give people information about how they can connect with resources that are being offered. And I do want to say, we obviously thank all of our first responders, our medical care workers, but I would also point out that all of these people here today and our nonprofits across this whole of Routt County are really on the front lines as well. They are out there meeting the needs of our community right now. So I want to thank you all for being here. I know you're very, very busy, so thanks so much. So I'm going to begin by introducing everyone, and then we'll jump right into our questions. So first of all, we have Kate Nowak, Executive Director of Routt County United Way, Sue Fegelein, Executive Director of Lift Up of Routt County, Stephanie Monahan, Executive Director of the Health Partnership, and Jason Peasley, Executive Director of the Yampa Valley Housing Authority. Again, thank you guys for being here. And I do want to mention the questions that we're asking today have been submitted through the city's website or through the newspaper. So these are actually questions that our community really wants some answers to today. So let's begin. Stephanie, I'm going to start with you for this question. What services are available through your organization, and how would someone access those services?
Absolutely. So the Health Partnership provides services through our care coordination team. We also employ health coverage guides. And so what that means to the everyday person is if you need help navigating the plethora of resources that we're so fortunate to have in Routt County, you can reach out to us. If you need help navigating the healthcare system, figuring out if you need to go in to see a primary care provider, or if you are in need of seeing a specialty provider, our care coordinators can help. They can also help access and navigate all of our community resources here in Routt County. And to get connected with a care coordinator, you can log on to our website, thehealthpartnership.org, or you can send an email at info@ncchealthpartnership.org, or you can call, which is probably the easiest way, 970-875-3630. In addition, I want to say we have health coverage guides that can help if people have experienced a loss of unemployment or a change in employment status. There's a special enrollment period that's been extended through the end of April to get health insurance through our Connect for Health, which is our state health exchange. Yes.
Very good. Kate, how about your organization, United
Way? Routt County United Way is a resource and referral organization for Routt County and has been for the last 35 years supporting our citizens. So people can call in to us and we will direct them to whatever resource they need first. We also have 211. That is a call center that's based out of Denver, but they have all of our information here locally. So if people can't get through to 879-5605, which is the local Routt County number, they can call 211 and get assistance on where to go. So that's really where we are at. And we also have a Human Resource Coalition one-page sheet of the top 7 resources that people need right now. So that's also helpful.
Fantastic. Thank you. Sue, how about Lift Up?
Thank you. So most important or the most used service that we have right now are our food banks. So we have a food bank located in Steamboat Springs, as well as one in South Routt and Oak Creek, and one in Hayden. And our food banks right now are open to anyone who needs food. We are practicing safety and social distancing, and so we are handing out boxes of food as opposed to people coming into the doors of our food banks right now. Our staff and volunteer safety is paramount, and we're implementing new practices almost every day. And then next week, I'll speak a little bit to this later, but we're switching to a delivery system in collaboration with United Way and the county and the Council on Aging. So that's really going to help people who are at home. And so first and foremost, we want to make sure everybody's fed. Secondly, we offer emergency financial assistance in a few different areas. So one is housing. So if someone can't pay rent or mortgage, we offer assistance with that. We offer assistance with utilities, although a lot of utilities are forgiving payments or postponing them right now. Medical costs, prescription costs, and other self-sufficiency needs, as well as for folks in a transient situation. So maybe perhaps someone who is just leaving the jail or is going through town and breaks down and needs to get to a place of support. Our case managers work with those folks to find out where that place is, and we help to get them there. Our main number right now is 970-870-8804, and that will get someone to a case manager. And our food banks, as of next week, like I said, will be delivery, but today you can drive through and or walk up to get a box of food.
Fantastic, thank you. Jason, how about Yampa Valley Housing Authority?
So at the moment, kind of our primary function is as a landlord for quite a few families in town. Our staff is still available to work with people as their needs change over time. So if you need to get in touch with our property managers, the number is 879-1862, and speak with them about your financial situation as it relates to rent. We're able to help with those for the properties that we do own, which would be Fish Creek Mobile Home Park and Hillside Village Apartments.
Thank you. And I would tell our audience, we are providing a lot of numbers and websites, and so this is being recorded, so you can look back and get that information, as well as there's a lot of information online at multiple sources. So don't panic, or also you could write this all down while they're speaking. So second question, Sue, we'll start with you on this one. What type of needs and demands are you seeing most from the community right now?
Sure. So food is the greatest need that we're seeing right now. In the 2 weeks, from March 16th through the end of March, we saw about as many people at the food bank as we normally see in a month, and so we expect that to increase. Additionally, the calls and or emails to our case managers are just starting to ramp up, so we expected April to be the month where emergency financial assistance is a greater need, as people have been laid off and those static bills become due. So we're starting to see that ramp up as of yesterday.
Okay.
Yeah.
Let's see. Kate, how about your organization? Have you seen an increase?
Yes, yes, we've been getting quite a few calls every day, every day of the week, and it's basically basic needs. People are losing their jobs, so they want to know what the first thing to do, which is to file unemployment, and then how are they going to pay their utility bill, their food? How are they going to get food? How are they going to take care of their shelter and their transportation? Those are the core basic need things that we refer people to. We refer them to the Health Partnership for care coordination. We refer them to Department of Human Services to sign up for government programs, which is really important. That's why they're there. And we also, of course, refer them to Lift Up.
Okay. Stephanie, how about your organization? Where are you seeing some increase?
Absolutely. We're seeing an increase like everyone else, phone calls, needing help, asking where to go. Our care coordinators are helping initiate a lot of the applications for the government assistance programs that Kate mentioned. We're also connecting them with Lift Up. One other surprising need that we're seeing is folks with animals who need help, and they're sometimes forgotten, but in this time of physical distancing and isolation, those are our companions and our opportunity to connect. And so we were really pleased to hear that our Routt County Humane Society received a grant to help people buy food for their animals or prescriptions for their animals. So our care coordinators are helping with that, also helping coordinate walks and things of that nature. So in addition to our own personal basic needs.
Oh, that's so interesting. I hadn't thought of the pets.
Yeah.
But they certainly are special at this time, I know for me. So, Jason, how about you all? Are you seeing a demand, an increase of services?
We are seeing a few more people who are late on rent, but not as significant as we were expecting, which is a good thing. I think it demonstrates that there's some resilience in the population that we're helping with that live in our properties. So we're pleased with that, but we're also here to help, not just this month, but every month moving forward. So.
Okay, thank you. Next question. Let's see, I guess, Sue, let's start again with you. If someone loses their job and has no income, where do they access resources for basic needs? What's the first step?
Well, they're welcome to come for food. We hand out a month's supply at a time right now. And if someone were to call our case managers, we're directing folks first to the Department of Human Services. We really want to make sure that everyone in the public realizes all of the resources that might be available to them right now so they can get as much assistance as they need. And so the first step is the Department of Human Services to see what they can qualify for there. We are also encouraging those who have been employed and are unemployed to apply for the unemployment insurance process. And then we're happy to talk with them about their remaining needs and see where we can meet them. It could be that they need assistance with rent and they've gone through all the other steps and they still need that assistance, and paying that rent will help offset some of their other bills. So we'll look at assisting them in that way. Or if it's utilities, we're trying to address the needs that they have at that moment, while also making sure that they realize there's all these other opportunities right now for assistance that they might not have known about, because it is a little overwhelming once you step into the myriad of services that we are fortunate to have. So we're trying to guide them to start at the beginning with the department and then make their way to us.
Yeah, I do want to tailgate on that for a minute. The Department of Human Services is a wonderful resource for people right now. The federal government and the state government is continually changing and providing more resource to our local Routt County Department of Human Services. And their lobby is open. It's closed off, by plexiglass or whatever glass. Yeah. But they can go walk in there to get an application and then see somebody behind a glass for case management. And there's, cash assistance, and there's additional emergency cash assistance sometimes that can be available in addition to all the food support and other programs. And there's other community support grants that they have that can help piece it together. So it's a great place to start.
Yes.
Anyone else have anything else to add? Let's see. Next question, Stephanie. What can the health partnerships, care coordinators, and health coverage guides assist people with? You mentioned them at the beginning, but maybe a little bit more in detail. What can they provide?
Absolutely. So a day in the life of a care coordinator. Our care coordinators are personal Routt County residents who are here, who have really strong working relationships with case managers at Lift Up, at United Way, at the Department of Human Services, at the Center for Independence, the Council on Aging. So they really are kind of general experts in who's doing what so that they can get people connected to the right resources at the right time. We also feel like we're kind of that resource hub where we can help send them to the Department of Human Services to maximize those benefits that people have been paying into for years. So if they need that support now, that benefit is there. We really are encouraging through our care coordination system for people to maximize all of those resources so that we can continue to use the kind of unrestricted support that is available in our community as the Part B to needing help. So our care coordinators are really there to virtually hold a hand and walk people through the system to get them what they need, whether that's assistance with housing, with food, with basic needs, paying utilities, things of that nature, or taking care of themselves. Our health coverage guides operate in a very similar fashion. They are available to help people understand all of the health insurance plans and programs that are available to them. They can connect them to a broker if they need additional specific guidance, but they're really there to be that navigation support to help people understand all of the different options that are there for them, and help them choose the one that's most meaningful and beneficial for them in the moment.
Thank you.
Yeah.
Let us, this is really for probably all of you to answer, but we'll start with Kate. How has your organization had to shift its mission focus in response to COVID-19?
Well, in some respects, it's all hands on deck for this crisis. Certainly, you know what's wonderful about Routt County is that we have the Human Resource Coalition, and that is made up of over 25 agencies in health and human services in Routt County. And it's all throughout the county. And United Way facilitates the HRC, which is the Human Resource Coalition. And when this COVID-19 broke, we started having weekly calls to coordinate all the services in Routt County. Yesterday, we had a call, and we had 36 different people on the call. And it was all about what resources are there for nonprofits to help them through this tough time, and how can we coordinate resources to be sure that we're not duplicating, that we're really aligning all of our resources for everybody in the community. And I want to be reassuring that this HRC has been in place for many, many years, a lot longer than I've been in the business. And so there's a network of human service agencies that work really well together and have been working well together, and coordinating resources for the citizens of Routt County. And so it's kind of cool to see all these experts come together and come up with the best way to serve people. And so that is something that how we've changed our focus is all about how to help coordinate these resources, avoid duplication, and get the most information out to the citizens of Routt County.
Thank you. Sue, how about Lift Up? How have you guys changed your focus, or maybe not? I don't.
Well, it's not so much a change in focus because our mission is, serving the basic needs of our community, but we have had to have a shift as far as prioritizing greatly the safety of our staff and volunteers at this time. And so, we have closed down our thrift store and donation center because it's not considered an essential business, and it was the safe, smart thing to do. And then we're focusing all efforts in our food bank and taking safety precautions that change daily. So it's everything from sanitizing food as it comes in, social distancing within, washing hands, maintaining the 6-foot distance between each other as well as clients. We're just, staggering who's there when in case something were to hit and we would lose some staff to being quarantined. That's our paramount concern right now, in addition to serving the community, is making sure that we're all safe, our staff is safe, and we're not spreading anything inadvertently. So just taking all the steps that are coming down from CDC, the county, as they come, which, as we talked about, could change in an hour or daily, and just staying on top of those and really prioritizing that safety of our staff and volunteers so that we can continue to serve.
Thank you.
Yeah.
Stephanie, how about the health partnership?
Absolutely. We have been living our mission of connecting people to resources, programs, and services, especially during this time. It's really elevated our work. And similar to Sue and Kate, how we deliver that service has shifted. Everything is happening remotely. Previously, our care coordinators would meet with people in their homes or meet them at our local coffee shops or in our office, whatever was comfortable for the individual, and now everything is having to be administered virtually. via distance, and that is somewhat problematic sometimes with broadband or Wi-Fi issues. So we're working through the kinks of that, but really grateful for the opportunity to work with HRC and our community partners to continue to share information and make sure that people have what they need at the right time, whether that's connecting to another nonprofit or having someone to walk them through the system. Because when people are in crisis, when they are in stressful situations or the unknown, having somebody to have your back and walk through that journey with you is what we're all about.
Good.
I do have something else. Sorry, Jason. I just wanted to get in here because the other big piece that we're doing right now is we're really ramping up our volunteer coordination, and we're working with Routt County Crisis Management Team. Paula Gregory is our contact there, and so we're working together. Amy Blake is our program manager, and we're working on where can volunteers be in the community safely and what can they do. And so currently we are accepting volunteer applications off of our website, and then we're working with Paula to determine what volunteer opportunities there may be. Right now, it seems like the most current volunteer opportunity is to deliver food, either for the hospital employees or for, Sue will be talking more about that shortly, for the food bank. So if people are interested in that, they can get online, and we have a group of volunteers that have already signed up that we're working with, but we don't know how many volunteers we're going to need for this program. So that's one big focus. You know, right now we would have done the Day of Caring, right? That's in May, and we don't know if that's going to go or not, but right now to do the COVID-19 stuff, that's where volunteers are needed.
Thank you.
I think I jumped on that.
Jason, have you seen a shift in your mission or focus?
Not necessarily a shift in our mission. Really, it's how we've been accomplishing our mission. You know, proper social distancing and communicating virtually. But as normal, our property managers are there to support the tenants at each of our properties, and we're continuing to work on developing more housing supply. Construction of Alpenglow Village is still occurring because it's an essential activity. We've had to change a little bit of the way we operate there just to make sure people are safe. But other than that, you know, it's business as usual with a little bit more care taken to, you know, safety.
Okay, very good. And that is, and you know, there have been concerns a little bit about construction projects, so that was good to hear. So you all have changed some practices there as far as the construction?
Yeah, so the county's guidance was that each project would need to come up with its own management plan, if you will, for how are you going to reduce the spread or keep distancing in place. So our contracting team is working on that. They've been working on it this week since guidance came out, I think Sunday night on that. And so the goal, you know, we're going to need affordable housing on the back end of this, so we want to keep that project moving. We also want to make sure that people working there are safe. So we're trying to balance those two objectives and keep that project moving forward.
Great, thank you. Jason, I'm going to go back at you with a question. Personal question, if I can't make my mortgage payment or afford rent, what are my options?
Yeah, luckily there's a lot of options available. So all of the federal agencies that back mortgages, FHA, USDA, Fannie, Freddie, they've all given authorization for there to be at least 3 months of forbearance of mortgage payments. A lot of the big banks, Chase, Wells Fargo, they're also doing the same sort of thing. So if you get in a bad spot with your mortgage, first and foremost would be to contact your mortgage servicer who you send your payment to. Then you can find out what specific program is available for your loan. So oftentimes, you know, you've originated your loan 6 years ago, you have no idea who owns it now, who's backing it. And that's not necessarily all that important for you to know. It's just, who do you reach out to? And that would be your mortgage servicer. They're going to know the details about your mortgage and what programs are available. On the rent side, if you live in a property that's managed by the housing authority or at the reserves, the property managers there have the authority to work with you on rent. So if you can pay rent, great. If you can pay a portion of rent, that's great too. If you can't pay rent, then they all have authority to work on different payment plans and work with the tenants on kind of sizing what rent payments they can do in the near term to meet their needs, understanding that people are out of work and that there's nothing we can do about that right now. And so that is, for the properties that the housing authority touches, that's the type of service we're currently providing, to really just flexibility and peace of mind that, we'll work with you. It's not going to be a situation where you're going to be evicted in 5 days because you didn't pay rent. And then I think the last thing is, if you've exhausted all of those options, you've talked with them, and you still need to make a payment, Lift Up is your go-to for financial assistance, either for mortgage payments or rent payments.
Great. Sue, anything you would add to that?
Yeah, so when those other options have been exhausted and people come through our case managers, again, we're doing that all by telephone or email. It's 870-804. They can apply for rent assistance. We've gotten some amazing donations and grants from our community recently that will help us see this through the next several months, which is amazing. And when they go through the application, it's important to understand that we don't pay the client. We send the check to the landlord directly or to the mortgage company. Okay. If it's, I'm not sure that all mortgage companies are doing deferrals, but we can help with that as well if someone is stuck with one that won't. And they go through the application with our case managers, and then they're able to get the assistance, and we'll send out the check right to their landlord. And our case managers are really awesome at working with landlords as well, as far as discussing late fees or the date that things are due, or just seeing if there's wiggle room, if they can be assured that we're there to, that the bill will get paid. So it's worth the phone call if they've tried all these other options and it won't work out.
Great.
Yeah.
Kate, how can a case manager at a nonprofit health and human service agency help me?
Well, I'll start out, but then I'll defer to these two that actually do case management.
Yeah.
But from my perspective, which is really United Way's perspective as a resource referral agency, we can share the resources on where to go to get help. But when you are with a case manager, they'll really sit down and ask a lot of questions about your situation and try to piece together all the different resources that are available. And we have a book in Routt County on all the resources that are available to you. So it's really important to meet with a case manager to understand, because they could say, if you have money for your mortgage or for your rent, but you can't pay a utility bill, well, there could be energy assistance for that. And so they can kind of piece things together to make sure that what money you have and what resources you have can be best utilized to meet all of your basic needs. So with that, I'll open it up to the two of you, because I think case managers are wonderful. Almost every health and human service agency has them. Okay. And so if you are in, for instance, a domestic violence situation, you would go to advocates for your case management. Right now, what we're seeing the most is basic needs. And so you would start out with the health partnership, go to Department of Human Services, and then Lift Up is really kind of the order that we are recommending people go to get their basic needs met.
Great.
I mean, I would just add that, our case managers are Tina and Susan, and they're amazing, and they will take the time, like Kate said, to work through the client's situation and see what the best services are for them throughout the county. I would encourage, if it's we cover medical costs and, like transportation to healthcare and things like that, but I would encourage, if it's a medical call to start with the partnership because that's their main focus is the health world. And so they might have some great tips and then end up at lift up if it just comes down to a bill that needs to be paid. But our case managers are working very hard right now. They send out an initial email, which also goes out, we have it in Spanish as well, to kind of give the lowdown on what's going on. And our phone number, again, is 870-8004. I keep looking to make sure I'm saying it. 8804. Sorry, I'm not saying it right. And then our website is liftuprc.org. And we have an updated link on our website to what we're doing constantly that has to be updated on a daily basis. So if something shifts in the case management world or otherwise, it will be updated through our website. But I would encourage people, if they're going through this, to reach out. Now's the time. And this is what the case managers across our county do best and are there to serve them. So.
Absolutely. Our care coordinators are trained to really understand, to have a conversation, to really identify what are those basic needs, what is the first priority, and then to connect with all of the many resources in our community, housing, et cetera. Additionally, people mentioned the resources. We have a couple of staff members who are compiling resources because they are changing so rapidly right now. Hours are changing. How are we accessing these resources that are here? And so our team, because it's a collective process, are working on maintaining those resource lists. They are available in Spanish as well, thanks to Integrated Community, one of our other nonprofit providers here in town, but those are available on our website. They also get sent out to the group every day between 4 and 5 p.m. so that we can all make sure we're staying abreast of these changes that are happening so rapidly. So if folks need help walking through, we're here. Our folks are trained in how to have that conversation so that it's not uncomfortable. Asking for help because, I'm the first one to say I don't always like asking for help, but this is why we're here. This is why all of our community partners are here. We've all been through training together on how to work with people so that it's not uncomfortable. So I just encourage people to reach out. If you're curious about what services are available, pick up the phone and call. Our number again, 970-875-3630. We guarantee we'll call you back if we're on the other line within 4 hours. We've got a whole team ready to help. And then the resources that we're all kind of managing collectively together can be found on our website, thehealthpartnership.org, and those are available by county and by service area. So if you have one particular need, you can find that there, but you'll also have access to see what else is out there because our own individual needs are changing every day as well.
Okay. Jason, anything? No.
All good.
All good. Okay. So we know that food banks are experiencing demand. So what kind of demand are you experiencing? And then as a follow-up, who can get assistance from the food bank and how can they do that?
So we are seeing an increased demand and we are handing out bags or boxes of food to folks, and that's going to shift next week. Anyone can get assistance from the food bank right now. Any Routt County resident. We are not looking at income levels. We're just serving. So if you need food, please come to the food bank. But not next week because we're changing that, and I brought the details. So we reached out and collaborated with Kate, United Way, with Paula Gregory, which Kate mentioned her name. She's part of the Routt Crisis Management Team, and with the Council on Aging to start next week doing deliveries instead of having folks walk or drive up to the food banks. We will still serve those folks who do walk or drive up because not everyone's going to know right away. But when they do, we will provide this information in the box of food that we give them. And it's a once monthly. If you come once a month, that's how much food we're giving out at a time. And so starting next Tuesday, we're moving to a delivery system. So folks who are age 60 and over can call 970-879-0633, extension 3, We ask people to call as much in advance as possible because we have the staff putting everything together for the pickup. And when you call, you'll leave a message with your name, physical address, phone number, email if you have one, and number of people in your household. And then also indicate if they regularly receive a senior box from us or a TFAP box, which stands for the Emergency Food Assistance Program. It's another box of food that our clients can get. And they will get a call back letting them know when their delivery will take place. And if someone is under 60, it's a different phone number. It's 970-879-5605, extension 12. And that will send it to a different group of volunteers. The over 60 group is going right to Council on Aging, and they're helping out with these deliveries. Under 60 is going through United Way, through Amy, who's coordinating all of these volunteers. Again, you leave, same thing, leave a message, name, physical address, phone number, email if you have one, number of people in the family, and whether you are a TFAP or CSFB client as well, the senior boxes or the TFAP boxes. The senior boxes most likely won't be because they'll go to the other number, but if there's a combined household or something, perhaps it will look like that. And then they'll get a call back. And the delivery system is going to be, Steamboat area will be Tuesdays and Fridays, North Routt will be Fridays, Hayden will be Wednesdays, and South Routt will be Thursdays. And so those are the days that deliveries will be going out. So folks can call 2 days ahead, and then we'll get the info the next day, and we'll have everything ready to go for the volunteers the day of delivery. And it was a very rapid, awesome, coordinated, collaborative effort to get this done, and to be able to say, okay, we're going to deliver to everybody starting next week is amazing, and it's going to help us keep operating because it'll reduce those safety risks by not having as many people approaching the food bank, and then allowing us to even further stagger staff and volunteers in the event that we had to have some folks quarantined. You know, we can keep some people there on certain days, and then we'll know, you know, were they there that week? Nope, we can call them into work to keep putting together the bags and boxes. So we will still serve people who show up, and then we'll provide them with the information to call the next month. I think that was everything I was going to say about that. I know, it's really awesome. So we're very excited about this switch and very grateful to, and this is something, you know, there have been so many people reaching out wanting to volunteer, and now here's something amazing that they're going to help do. So
Great.
Yeah.
And I do know that John Russell is working on an article about that, so you also can read about it and have that on steamboatpilot.com and in the paper. So,
Thank you.
Jason, another specific question. If someone can't pay their rent at one of the Yampa Valley Housing Authority properties, will they be evicted?
No.
Okay.
The Housing Authority has suspended evictions for non-payment of rent for the months of April, May, and June. And we've also suspended late fees on rent for those periods of time. So the goal there was to take away the uncertainty or anxiety related to housing security. You know, if you live in one of our properties, Hillside Village Apartments, Fish Creek Mobile Home Park, the same is true at the reserves. You will not lose your housing if you're not able to pay rent. That policy is in place for, like I said, for the next 3 months. We'll be reevaluating that and amending that policy as needed. You know, ideally we won't have to, but if we need to, we will. So, you know, our message to our clients is just, you know, your housing is secure, your housing is safe, so that you don't need to worry about that during this period of time.
That's great. Nice peace of mind.
Mm-hmm.
Yes.
That's awesome.
Sue, we keep directing things to you, but the next question. We do have a lot of people who are concerned with kids out of school. We know there are children that depend on the free and reduced lunch program. So how are there options for kids to make sure there's not children going hungry in our community?
So all of the school districts in our county have been amazing in this regard. So the Steamboat Springs School District is delivering lunches and next day breakfast via buses going out to different areas on certain days of the week. Any student can go. You don't have to be free and reduced lunch.
Okay.
You can just show up and get that food at those buses. I think they have the schedules probably on their websites. We've put them out on ours. We've shared it on Facebook. And similarly, in South Routt, this week they started that process as well, getting food out via buses to any students. And they're doing a similar program in Hayden, which is slightly different. They have a certain day of the week where folks, I'm trying to find it on my notes, I apologize. So it's lunches for any child up to the age 18. They're handing out a week's worth of lunches between 5:15 and 6:15 on Tuesdays, and it's 4 days worth of lunches because they're a 4-day school week. And so each school district has completely stepped up and are feeding our children, which is incredible and a huge relief because this was foremost on our minds that lift up, what about these kids? So the school districts are amazing. We still do our Rocket Pack program, which is healthy snacks for kids. It's bags of snacks for a week. We are sending them out to Hayden and South Routt for the schools to also hand out. And then in Steamboat, people have been allowed to pick them up at the food banks. What that will look like with delivery, we're not 100% sure yet, but we are handing out also with our boxes of food. Any family can come and get them, and it will be enough. It's a supplemental amount, but it's a lot of shelf-stable foods and other foods for the appropriate family size for the month. So we're trying to make sure all the kids are fed.
Great.
Yeah.
Thank you. Stephanie, what about our non-English speaking populations? Are there special programs in place that help them access assistance?
Absolutely. So I know our first and foremost go-to for our Spanish-speaking population resource in Routt County is Integrated Community. I know their caseworkers are working round the clock like the rest of us to really support that population as well. As I mentioned earlier, we're translating as many of the resources and applications and things of that nature into Spanish. A lot of our healthcare centers have interpretive services, so if you're Spanish speaking, you're welcome to use one of those or another language as well. Our care coordinators also have access to a translation line, so if they can't connect, if English isn't your first language, they can help with that aspect as well. The most important thing is to reach out.
Anyone else need?
Yeah, I just wanted to mention the integrated community of people have a vibrant young leader group called Latinx, and they are. I read about it in the paper, and then followed up with integrated community on it. But I think it's just really wonderful because what they're doing is every day they are. Putting on Facebook information about what the resources are for community members in Spanish to their community. And I think it's just a great way for them to keep communicating what's going on and what resources are available.
Yeah, and just as I mentioned earlier, our case managers have an initial email that they send out to clients, and we have it in Spanish and English. And in Spanish at the top, it does reference integrated community, and that if you're going to need translation, it can be provided. And so our case managers then engage in a 3-way call utilizing integrated community to translate the call. And also physically in our food banks, although we don't have folks walking in, we do have 2 Spanish-speaking staff who can help interpret if that comes to pass. And so really integrated community is the go-to resource in this area.
And I would add that some people don't know this, but on steamboatpilot.com, you can translate it into Spanish. It's the only language, but you can click, and every article and everything online is translated into Spanish. So that's something else we want to let people know because it's a tiny little button, but it's up there and it can do that. So, Stephanie, let's see. Another vulnerable population are senior citizens when it comes to COVID-19. So, what help is available specifically to seniors?
Right. So another amazing resource that Routt County has is our Council on Aging. They predominantly focus on our senior population. Casey's Pond is also doing a lot on social media around activities for seniors and what it's like. Our care coordinators have been reaching out to all of our clients in that age population to check in on what resources do you have? How are you feeling? Really doing that personal connection to understand, because a lot of our seniors can be isolated in this region, and getting a sense of what is their social network if they do need assistance grocery shopping, if they do need assistance getting connected to the food bank. Things of that nature. And for a while, we were concerned about toilet paper here. I'm glad to know that that's not a top priority at this particular moment. Yay, that's not true of our Front Range counterparts. But really figuring out how we stay connected to that population. We're doing weekly phone calls to connect. And I know there are a lot of other agencies around Routt County who are doing the same. And Sue mentioned a huge outreach regarding food with Council on Aging. So we're really lucky here when we take advantage of these programs.
Yeah, our go-to is Routt County Council on Aging, and they are providing meals to, actually delivering meals to people that are seniors. And any senior can call up and get on that list. And basically, they're getting a hot meal at noon or right around noon for the noon lunch, and then one frozen dinner. And they're, generally speaking, getting delivered 4 times a week. So it's they're busy cooking up meals and delivering those meals. Another thing that the Council on Aging is doing is they have a pool of volunteers that just want to call seniors and have a conversation with seniors. Right now, the real danger of seniors is to be isolated and fall into depression. So having that connection over the phone is really important, and Routt County Council on Aging has pulled that together. They also have put together personal care packages, and so 1 roll of toilet paper, 1 roll of paper towels, maybe some cleaning items, and they're putting those packets together and delivering those with the meals. So we are very fortunate to have the Routt County Council on Aging. They have a great board of directors and a volunteer group of people that are helping our seniors in Routt County.
And just to piggyback off of that, Kate mentioned this time of potential depression for isolation. I think that spans all populations. I was talking with a group of parents, virtually of course, and our kids are isolated at home. And sometimes that can be really problematic and stressful, and that really does span all populations. So I really want to encourage people also. One of the amazing resources that we have in Routt County is reps, Reaching Everyone Preventing Suicide. They are there for crisis if you need help connecting to a provider, or if you need someone to talk to. It's an amazing resource for not only our young populations, but also all the way up to our seniors. So I encourage folks to connect with reps too.
Great.
And Mind Springs Health.
Yes.
And them.
Yeah.
Yeah. Yeah, it sounds like there's no shortage of resources out there.
Absolutely.
So that's great to know. Let's see. Okay. One thing, Kate, I guess you had mentioned it a little bit at the beginning. With the stay-at-home order, are there still opportunities for people in the community to volunteer? I know we have a lot of generous people who'd like to actually, do something to help during this time. Are there opportunities?
Well, there's very few, to be honest with you, because of the stay-at-home order. We want people to be safe, but we are coordinating with Lift Up to do this food delivery. And I think we figured that we broke out the geographic of Routt County, and of course we're a huge county, into about 7 or 8 different areas, and we want to have 3 volunteers per area. Okay. So there's a group of that we're going to need, and people certainly can get on our website to fill out the volunteer form. There will be a background check and a waiver liability to sign and so forth, and we'll require volunteers to wear gloves, a mask, leave the food on the doorstep, ring the doorbell or knock on the door, and then step 10 feet back to make sure that that food is brought in to the house. So we really want to make sure that we're very careful with our volunteers. There will be a risk that a volunteer will take when they are delivering food or any kind of volunteer person-to-person, kind of thing. But we want to keep the distance. Like when they go pick up the food at Lift Up, they won't be allowed out of their car. And so a volunteer will come up, or somebody from Lift Up will come up 10 feet away and ask them, what area are you going to deliver? And they'll get the food and put it into the car for that volunteer. So there's no, we're doing all the safety precautions possible. But I would say that if you are interested in volunteering, to go ahead and sign up on our website and get in queue. So as we have this whole thing unfold, if there are new volunteers, opportunities that come up, we'll reach out. We'll certainly touch base with you as soon as you sign up, so that you know that we're connected. And then as volunteer opportunities come up, we can reach out.
Great. Anyone else have anything to add on that?
Thank you for doing that.
Yeah, it's amazing. And it even might be, again, everything changes by the hour, but when the volunteers come to pick up food at Lift Up, we might even just have them call in.
Oh, that's
say,
even
"I'm
better.
here." And we are utilizing still some of our volunteer force at Lift Up. We have a very stringent intake sheet every single day that our staff and volunteers have to go through and answer everything. Have you had any symptoms? Does anyone live with you that's traveled? Where, have they traveled to any of the hot regions? All of this stuff before they can even start work that day. So it's a very limited number of folks volunteering with us right now, which is appropriate. And then we kind of have a backup. We're trying to keep backup teams, whether it's staff or volunteers, ready to go in the event that others need to step in, so that we can just continue to operate. And we're super grateful for our volunteers and for this task force. And I have heard of a lot of volunteers sewing masks right now. And even just today, this morning, I heard from a segment of the county that they are going to start recommending everyone who is handling or delivering food wears the homemade cotton masks, or I don't know if they're necessarily cotton, but I appreciate that people are sewing them. That is not in my skill set, and we're very grateful. I've seen a lot of it on Facebook and in other places, and we're really grateful for those folks. And all the restaurants right now that are doing takeout or otherwise operating are going to need them as well. And so that's a great thing for folks to be doing if they enjoy doing it. Now they're, it's a sanctioned need right now.
Absolutely.
Fantastic. Good. Let's see. We're getting down to the end, closer. Stephanie, we'll start with you, but I'd like all of you to answer this. How can the community help your organizations at this time when demand for your services is high, or in general?
Absolutely. I just would like to start with saying that we're all in this together, and we're thinking and promoting our own health and well-being, and that means being safe, stable, and secure in our housing, in our food, in being able to pay our bills and taking care of ourselves. So I encourage everyone to put on your safety air mask first, or fill your cup of water first, and reach out if you need help. Call. There are so many nonprofits in this town who are eager and ready to help, so I encourage you to call. I also got an email earlier this week from a teacher who was concerned about their neighbor, and reach out. Connect. If you know somebody around you in your sphere needs help, reach out and ask if you can reach out on their behalf. But this is what Routt County is known for, is coming together and helping, and now is a really great time to call, ask for help for yourself, or make sure that those people in your virtual social circles are cared for as well.
Jason, anything that people could do to help the Housing Authority?
The Housing Authority itself, I think we're in fine shape as an organization. The people that we serve, I would agree with what Stephanie said. Just being very neighborly and keeping an eye on the people that are in your social circle, to help identify needs and things like that, and then continue to support our nonprofits that are providing those direct services like Lift Up, and that can help deliver resources to the people that need it.
Absolutely. Great. Okay. Sue, how can people help lift up?
Well, we appreciate, I mean, the community support is overwhelming right now, and it's amazing. And I keep saying this, but I'm so grateful to live here and to the, whether it's people power, financial support, our community has just risen above and beyond. We do still need financial support at Lift Up. We've been getting some amazing donations. You know, Deer Park is giving us, it was in the paper, so I feel okay saying it. They're giving us $50,000 a month for our housing fund for each starting this month for the next 4 months, which will ensure everyone who needs housing assistance receives it. We still have other areas, other funds that we need financial support with, whether it's utilities, medical assistance, self-sufficiency, transient issues. As a nonprofit, you know, we all have different budgetary years. Ours is a calendar year. So while we budgeted for the entire year, it's April. So we don't necessarily have all the funds and grants that we wanted coming in this early on. And we are closed in our thrift store, which is, we're very fortunate to have a thrift store, and it's our main funding source. And that's at least $24,000 every 2 weeks that's gone. And we use those funds not only for programs but for operations. And while it may be less glamorous, all of our nonprofits have to cover staff. You know, we have bills, we have electricity, we have loan payments or rent. Those are important areas to support as well, in recognizing that there do need people there to run the ship. And the support that we need financially right now continues despite all the amazing grants. You know, we've had the Steamboat Group and the Home Ranch and all these incredible outpourings of support and matching grants and a lot of individual donors. So while it may seem like, oh, they got this huge grant, they're fine, we still are leaking our main source of funding, which is the thrift store, and we don't have a substitute for that. And when it comes to food, providing financial support instead of food itself not only helps keep people at home and not necessarily driving across town to the food bank, but also we're a key partner right now with Food Bank of the Rockies, and typically, you know, the amount that we can buy is 4 times the amount that you could buy locally, and so the money goes farther. And I understand some people are passionate and still want to give food, and that's welcome. We are steering slightly away from fresh produce right now because of the, you know, you're supposed to be washing everything with soap and water, and that takes a lot of time and human power that we are focused in other areas right now, even though we're very passionate about serving fresh foods. Usually, it's just, we're trying to focus more on the shelf-stable foods and let the local stores keep their supplies of fresh foods, and then we can supplement throughout the month with the shelf-stable foods. And we will be having a food truck arrive on the 8th, and so we will be replenished on all fronts, whether it's fresh or shelf-stable foods. But we do have plenty to get through then, too. So that's a long answer, but financial support is still needed, and we're incredibly grateful for what we've received so far. It's truly amazing what our community is doing right now.
Thank you.
That's great.
Kate?
Yeah, I would say that, support your nonprofits right now. It's this whole situation with the COVID-19 really touches so many different lives in so many different ways. And that's why we have such a great network of human service organizations in Routt County. So I would say if you support an organization, consider, if you can, doing a little extra right now for them and a donation. I'm thinking about advocates with domestic violence and people not being able to get away from a spouse that is violent. I'm thinking about some of the youth organizations that have kids at home and parents at home and one computer and 2 people are supposed to work plus get kids on the computer. I'm thinking about those organizations. I'm thinking about the Routt County Council on Aging and how they're reaching out to our senior population and Lift Up. Help. There's all these organizations that are really meeting the needs of our community right now, and I think if you can do a little extra right now, it would be great.
Good. We've got 2 more questions. So one, and I guess maybe Kate will have you answer this. for the first time, for a lot of people, they're suddenly having to seek assistance for the first time, maybe in their lives. What would you say to them about accepting help?
We're here for you. This is why we exist. I mean, we are friendly, we are your neighbors, we are your friends, and we want to help. And there are resources that need to be used. I mean, we want to use the resources. We have funding, we have manpower, we have physical food, we have those things to help you. And now's the time to take advantage of that so that you can keep your stress level low and continue on and look for the next rainbow. You know, I mean, we're here for you.
Yeah. Anyone else have anything to add?
Well, I would just add, it can be so hard and so intimidating to ask for help, and it's embarrassing sometimes. And, you know, it's really a time to look at, we are all in this together right now, not locally, but globally. The whole world is in crisis right now, and it's an okay time to reach out. And some people, you know, we see it a lot at Lift Up. It's very hard to ask for help, but, you know, look at it as, you know, have you ever brought your old clothing to Lift Up? And if you have, you've fed your neighbor. And so now it's your turn. You know, we're all in this together. We have food for everybody. And it can be upsetting, and that's okay. You're allowed to be upset, but you should still ask and still reach out for what you need, because it's here, plentiful in our county. It's just a matter of getting to the right resources, and they're there for you. And I will acknowledge, I remember the first time I ever had to ask for help in my life, and it was very difficult, and I was really upset. But then it was like, oh, no biggie, you know, like once it came through, and I was like, oh, well, that was awesome, you know. And I feel like that's how our organizations are in this county. They're here to serve, and they're here to help, and it's what we want to do. It's what we're here to do. So please reach out.
Absolutely. Reach out so that you can do what you need to do at home. Let us provide these amazing resources for basic needs so that you can take care of yourself and your family at home and keep doing your job, whatever that might be.
Great. Okay, last question. Jason, we'll start with you and maybe move through. And this may be a little bit more personal, but what would you suggest people do to stay resilient and somewhat strong during this time?
I mean, I think everyone's experiencing a whole lot of uncertainty, especially related to income and what's coming next, how long is this going to last. I guess from the Housing Authority perspective, communication is the most important thing. You know, if you were able to make rent on, on April 1st, that's awesome. If you're feeling unsure about May, reach out to your landlord. It doesn't have to be the Housing Authority. It could be whoever your landlord may be, or your mortgage company. Reach out to them. Let them know what your current situation is. When whoever it is has that information ahead of time, they're much more able to work with you. And you'll know what resources are available, and that can ease a lot of the anxiety or tension related to your housing situation. So communicate early. There's no shame in the situation that you're in. It's nobody's fault that you're out of work or that money's tight right now. It's happening to a lot of people. So communicate, reach out, be honest about what you're able to do, and your landlord, mortgage company, that chances are they're going to be able to work with you.
Thank you. Stephanie, what advice would you have?
Absolutely. So we like to think of personal resilience in 4 pillars. Checking in on ourselves. What do we need in this moment right now to feel better? It might be taking a walk outside if it's not still snowing, drinking a glass of water, getting something to eat, and then creating some semblance of a schedule. You know, what we know about neuroscience is our brains like structure, and it creates that sense of stability. And so whatever that means for you, come up with a schedule, write it down, share it with a friend, that accountability buddy. We've all heard that before. And then focus on self-care. What do you need to feel better? Is it going for a walk? Is it calling a friend or a family member? Figuring out how you're going to take care of yourself. Some people might meditate. Some people, might hug for a little bit longer with their loved ones at home. And then I think the most important thing that we're seeing right now is connection. So figuring out how you can do that in this virtual world. I've seen a lot of things on Facebook here in Steamboat with people singing on their porches. The power of voice is really instrumental, and not only do we feel better, but it also has some magic power for our brains too. In addition to these simple pieces, the Health Partnership is also offering free personal resilience workshops. They're done virtually, so if you need help or need some other tools for your toolbox to take care of yourself right now, reach out. Mind Springs Health is also offering some resilience workshops. There are a lot of tools out there that are free and that are here to support you in this potentially uneasy, unsteady time. But those are just some quick tips.
Great, thank you. Sue, any advice?
I would just add to that, try and get outside. It's okay to go outside. If you maintain social distancing, it's fine to get some fresh air. Also, I'm one of the ones in the boat where my kids are at home. I'm trying to homeschool. I live in Clark. I don't have any internet. We're using my phone as a hotspot, and I'm trying to run Lyft Up. And you have to get to a point where you forgive yourself. I mean, literally, one of the calls I was on with Kate, I was sitting on top of my truck trying to maintain Zoom internet while my daughter's sledding, my dog's there. And we're all kind of in the same boat, which is great. We're all very human, and we're seeing the humanness of those we regularly maybe interact with on a more professional level. But you have to let go a little and forgive yourself. In my case, if all your kids get done schoolwork-wise is making slime, and that's their art project for the day, it's okay. We're alive, we're eating, we're getting some fresh air, we're laughing a little bit, we're doing our best. Everyone is being lenient right now, whether it's the teachers, the school district has been incredible. So those of us in that boat, we're kind of all together in this, and you have to be a little lenient with yourself. You can't maintain perfection. You can let the dishes go a little bit, or maybe that's your one saving sanity is I'm doing those dishes. Do whatever it takes to get through each day and know that we're all in the same boat. And I would add also to phone a friend. Just pick somebody and check in with them and have a 5 to 10 minute chat on the phone and make sure that they're doing okay as well.
Thank you.
Yeah, I think it's a perfect time to reach out to people that you know. I know that I've connected with people that I haven't talked to in a couple months, just to say, hey, thinking about you, how are you doing, that kind of thing. I think that is really, that personal connection is really important right now.
Okay, we are at the end of our questions. So as I've done with other panels, I think we'll just go on down the line in case you have anything to add. So Kate will start and go this way.
Well, mine's short and sweet. Take care of your neighbor. That's where I'm reaching out. I have a 91-year-old girlfriend that I check in on and make sure she's doing okay. My antenna is up as I'm walking my dog in the neighborhood to see if everybody's doing well and okay. If there's somebody that I need to reach out to help my neighbor, I want to be able to do that. So that's what I would say is take care of your family, take care of your neighbors. If you know of somebody that needs help, reach out. There's lots of resources. And support your nonprofits. We're here for you to not only give you services, but also to receive any kind of support that you can give.
Thanks, Kate.
Yeah.
Sue.
Yeah, similarly, we're here for you at Lift Up. Please reach out to us. I want everyone to practice safety. It's so important right now, but know that we're here. You can reach out. If you know someone in need, we do allow folks to come through a proxy. So if you're coming to pick up food for someone else, we can mark it down, and that's just fine. Again, it'll shift to a delivery system, and we can accommodate for that too. But I appreciate everyone keeping an eye on their neighbors and know that we're here for that basic needs support of food and emergency assistance with shelter and utilities and medical needs and some other needs as well. And so please utilize our support while we can. Thank you.
Thanks, Sue. Stephanie.
The Health Partnership is really grateful for all of the nonprofits here who are doing so much. So I think to just echo what Sue and Kate are saying, say thank you to your nonprofits, reach out, ask for help. We're all here, we're human, and we're all doing the best that we can. Everyone has the very best of intentions. So thank you for the nonprofits who weren't able to be part of this because we are social and physically distancing. We hope we represented you well, and for listeners, reach out and take care of your neighbors and your friends because we're here to help and we're all in this together. So thank you.
Thank you. Jason?
Yeah, I just want to, I guess, express my appreciation for all the frontline workers out there in the medical field, folks delivering food, really taking care of the basics for everyone in our community, making sure that everyone has the support that they need. So I really appreciate all that.
Thank you. Well, that will close, and I do again want to thank each one of you for being here. I know personally, it's a roller coaster some days of emotions, and I woke up a little blue, and you're just sitting here and hearing you all talk about what is offered in this community actually lifted my spirits, and it reminded me that we're lucky that we're experiencing this here in Routt County. I firmly believe that. So I also, when we were talking about volunteer opportunities, what came to my mind is, you maybe can't physically volunteer. So now I know a lot of people are hurting, but if you're not and can offer a cash donation or a monetary donation to nonprofits, I know it would be appreciated. So those that are really wanting to volunteer, I guess that's how I would suggest that you go. We will be having a second part on Tuesday. We will be having advocates and reps and some of the other nonprofits here. Again, send your questions for future panels to covid@steamboatsprings.net. You can also send them to news@steamboatpilot.com. And also, we have been publishing silver linings in the paper and online. And so if you have something that you see in your neighborhood, someone does something special for you, please send it to share@steamboatpilot.com and let us tell that story as well, because there's so much positive going on in the midst of a lot of uncertainty. So again, thank you all. Thank you all for watching.